All right, well, we certainly do live in a youth-obsessed society, and most of the images we see in magazines are young, flawless, and wrinkle-free, right? But needless to the popularity of plastic surgery continues to rise. From facelifts to chin lifts, male or female, you can have it all. Joining us today is cosmetic surgeon Dr. Robert Yoho to tell us about some of the more popular procedures that are out there and available for everybody. Welcome back, Dr. Yoho.
Thank you, Alex.
It's good to have you here.
Thanks.
Today we are actually talking about facial, is that how you say it? Facial procedures, facelifts, and that kind of thing?
Yes, facial cosmetic surgery.
A lot of people are afraid of this.
They sure are.
Why do you think? Well, aside from, you know, a needle cutting or a knife cutting into your face, but why do you think that is?
So many Hollywood figures have gotten a lot of facial surgery, and eventually they just get so stretched and so unnatural that they just don't look very good. So that's the reason, I think.
Okay, so people are afraid that they're going to get the...
Right.
Okay.
We tend to put together a lot of little less invasive procedures to make it more natural. That's what we...
Well, so what kind of procedures then would you do, and how do you ensure people or reassure people that they're not going to look like this?
Well, you have to individualize it. You have to have a consultation and decide what everyone needs. And there's a whole menu of small things from Botox to fillers to small facial implants to right up to the facelift, and eyelid procedures are usually regarded as a minor procedure that can help the whole face look better.
Okay, so brow lifts. You're talking about brow lifts?
Well,
or is that different than eyelid?
We're not as fond of brow lifts. We think that a lot of the times the excessive brow lift does produce some of the surprise look that everybody hates. But we do brow lifts on an appropriate candidate. And Botox can even produce a little bit of a brow lift because you Botox the muscles that pull down and the middle of the brow goes up a little bit.
So what about the eyelid surgery that you were talking about? Because I know a lot of people that have gotten that because their eyelids start to droop a little bit as you get older, right?
Alex, we're in the bag removal business.
Oh, I love it.
Okay. So we take out the lower fat through an incision in the inside of the lower eyelid, and then the upper eyelid, we actually remove some of the skin, a little fish-shaped piece of skin from the upper eyelid. And that produces the improvement.
So women no longer have to worry about getting bags under their eyes because you can easily get rid of that?
Well, I don't know whether they're worrying about it, but we can improve a lot of them. Yeah.
Oh, good. Well, it's amazing what you can do now, the different types of procedures. What about, though, for men? Because I know that maybe some men have this problem.
Well, John Wayne was considered a sexy guy right up until the time he was in his 80s, and John Wayne had upper eyelid droops that were almost down to his nose. So it's an individual decision for men about the upper lids, but cleaning that up can often make them look a lot better, and if it's overdone, of course, you can sort of feminize that area. You can show too much upper lid, so it's a more conservative surgery for men. And in the lower lid, the men's surgery is just the same as the women. We take away the bags and we smooth the skin.
What about the excess skin that's left over?
That can be taken care of either through a little pinch of skin taken from the lower lid, or better, we laser resurface or resurface with a chemical peel that area, and that shrinks it very evenly, and that produces a nice, even, smooth lower lid.
I know we have some pictures, before and after pictures, that we'd like to take a look at. Can you describe what was done to these people, what kind of procedures?
Well, this lady is a star. She came in and she said she wanted to be on her website, and so she had a little mini facelift, cheek implants, and a chin implant, and she didn't have a peel, she didn't have her eyelids done, and that's the great result. And she smiled and put on makeup for her after pictures.
I love it. She looks really good.
Thank you.
She even got her hair dyed, it looked like. Total transformation. Yeah. Okay, the next picture, what was done here? Wow, that looks good.
Yes. Now, this lady had a laser peel as well. So she had the cheek implants, the chin implant, the facelift, the laser peel, and the eyelids. So she kind of got the blue plate special. She got the whole thing. You don't have to do this much on most people, but in this case, she really benefited a great deal. So
that's a lot. What was her recovery like?
This recovery is probably realistically a 2-week recovery.
You know, before not too bad considering everything she got done.
Before you're back in makeup, and you're still swollen at 2 weeks, but you're usually pretty functional. we like to do combinations of procedures which are generally a week to 10 days of recovery. But obviously we can't guarantee.
She looks totally different. Wow. Okay, let's see
Improved,
if we have
improved,
very
Alex,
improved, very
not
improved.
different.
Another improvement here. This is a pretty little girl. Oh, not little girl, but young lady.
Yes. This little girl or young lady, she may not be 20, but she got nothing but chin liposuction and jowl liposuction. That's it. And she put on some beautiful makeup for after photographs, and we didn't do anything else for her. And of course it's a home run.
All right, and let's see if we have any other pictures. Okay.
Now this is fascinating. This one almost got a Julia Roberts look when we put angle of the mandible implants and a chin implant for her. And her side views you can look at on the dryoho.com, but you can see those little arrows, how I thickened. Her whole jaw was kind of deficient. And we thickened her angle of the mandible, and I think it's just a beautiful effect. You know, Hispanics have very nice, strong jaws, and a lot of the rest of us don't. Strong jaw is a beautiful thing on a woman. It just is wonderful.
It looks nice. Looks very nice. Let's see if we have any other pictures. Look at that.
Well, this is a laser peel. Now, you can't see the detail on the left picture, but this lady has a lot of crepey skin on the left, and it's pretty much smoothed out perfectly on the right. And this is about a week-long recovery before you can put makeup on.
Okay.
You're wrapped up sort of like the Invisible Woman for the first couple of days.
Well, Dr. Yoho, I know you practice in Pasadena, but you also have an office here in Visalia, don't you?
Yes, that's correct.
For those of us in the Central Valley that might want to go see you or have any questions or need a consultation, right?
Thank you for mentioning that.
Oh, sure.
Okay.
dryoho.com?
Yes.
All right. Well, listen, thank you so much. And we were talking about maybe cheek implants. What do you think?
Well, I think you don't need cheek implants.
Oh.
I think
Eyebrow lift.
just a little injection of a little filler there.
Oh, okay.
Just maybe to improve this area right here.
Okay.
That would
Any
be all you
improvement?
need.
Any improvement is nice.
I think you're perfect otherwise.
Thank you, Dr. Yoho. I appreciate it.
Thank you so much, Alex.